October is Breast Cancer Awareness Month, and there's a lot of events going on to raise awareness, to raise money for it. But let's talk about the medical side of breast cancer in general, and that's why we bring in our favorite doctor, Dr. Quinn. And Dr. Quinn, first off, getting checked is probably the most important part of this whole process, and getting checked regularly. What are your suggestions for getting checked?
Well, here's the deal. Have a conversation with your medical provider, because everybody has what's called a history, and their history determines how often they should get checked. Let's hypothetically say it's a lady that's younger than 40, and her mother died of breast cancer, diagnosed at a very young age. She has a different family history. Or if the lady has a mass, then she needs to get checked sooner than 40 years of age. But have that conversation with your medical doctor. What's so great about Breast Cancer Awareness Month is it raises awareness and puts it at the top of the mind for many people, so that there's a higher probability that they will get that screening. And if they're diagnosed, it's diagnosed earlier, and treatment is so much more effective.
Is there a certain age you should get checked at and start getting checked? And then is it every 6 months, every year, every 2 years? What's kind of the basic timetable?
That's a good question. The bottom line is it depends on the individual person. Everybody has a different history, but everybody needs to have a conversation with their medical provider at least once a year. And then depending on what they tell the medical provider, the frequency or the time of testing can be different depending on that person.
Yeah, and people forget that this is something men can also get as well?
Most definitely. I've had, over the last 23 years, I've had a couple of men that have been diagnosed with breast cancer. But the deal is they had a conversation with me as their medical provider to let me know that they felt something. We did an exam, and then we felt the same mass that they articulated to us that they felt, and we sent them to get what's called an ultrasound, and they ended up having breast cancer. It was diagnosed early, it was treated, their life was saved.
Yeah, and I guess what is the protocol for if you are younger than that age 40, or you haven't been checked before for this? Is it, I mean, I get that lumps can be a big one. Is there any other signs that you could see that may push you towards the doctor?
Yes, of course. You can have what's called expression from the nipple of your breast, where a woman could have some type of discharge coming from the nipple of her breast. These are things to worry about: tenderness, redness, soreness, which is tenderness, just anything that's abnormal. If it ain't right, let your doctor know right away. Say, hey, I'm concerned about this. Get that exam. We do a breast exam on everybody, even when they're younger than 40. We're checking, but the most important thing to remember is have a conversation with your doctor. Go get checked out. Don't just assume everything is okay. And the earlier it's diagnosed, the earlier treatment is initiated, the better chance that you'll get a better outcome.
Yeah, and you kind of touched on this a little bit before, and I think this is the biggest part of all of it, other than just trying to keep people healthy, is the word awareness. Awareness is in the month. It's Breast Cancer Awareness Month. And for you, you're trying to bring that awareness. How important is that part of this?
Oh my goodness, you cannot overemphasize how important awareness is. When you're thinking about something, you're gonna check it out. Let's hypothetically say you live in a neighborhood with a lot of robberies. You're gonna be more hypervigilant about watching out, because awareness brings more screenings, more early diagnosis, more treatment at an earlier stage. And as a medical provider, I can't overemphasize how much more effective treatment can be if you catch it earlier and start that treatment early before it spreads.